In this video, we are going to learn about EEG, that we all know is electroencephalography. And what is electroencephalography? It is a recording of electrical activity of the brain. So we are recording the electrical activity of the brain. Now 2-3 questions. First, who is the inventor of this? The answer is, it was invented by Hans Burgers in early 20th century, exactly 1902 something. So Hans Burger. So in fact, there was a question in AIMS exam. It was कि a examiner want to ask a first year MBBS student कि who invented the EEG, and the student was not able to recall. And then the examiner said something you eat at McDonald's is a hint. So the student said McDonald's, burger. He said yeah, now oh, burger. So that's why if you remember from burger, the name of burger, that is called as priming. So burger help you recall burger. So that is burger is an example of priming. That is, you prime your brain to a stimulus which is similar, and that will make you remember the name burger. So that's why burger make you recall. So name priming is a recall method. So that is called as Burger. Okay. Now Hans Burger recorded the EEG by placing the electrodes over the scalp. So how to record it? It is recorded by placing recording electrodes over scalp. Now we can directly place over cortex also. If you place over cortex, is called as electrocorticography. Then it becomes electrocorticography. But it's an invasive procedure, so obviously electrocorticography. Maybe if Elon Musk invent or rather bring his Neuralink, you know the Neuralink project where they are trying to put electrodes on the brain and connect it to the computer interface, and then you can control the machine just by your thoughts. Okay, so you don't even have to type message, you think and the message goes. So it's very similar, electrocorticography. Okay, now comes the question. Question is, what is the electrodes record? And it could be different numbers, like it could be, and where the location they are put over the frontal, the parietal, temporal. Okay, and where they are put over parietal, temporal, then central part, occipital, etc. That's why we give the name as like P1, P2. So that means they are put over various areas of the cortex, frontal, occipital. Now what are the number of leads? They could be 16 or it could be 32 leads also. So 16 or 32 leads. Now question is, what is the source of the electrical activity? So the source of the current. So basically the source is, yes, the fluctuations, you have fluctuating dipoles. Fluctuating dipoles. So fluctuating dipoles at dendrites of cortical neurons. So 2-3 question. First, what is the source? The source is your cortical neurons and it is their fluctuations. Okay, the dipoles or the fluctuating dipoles, they are the responsible activity. Are you clear? So fluctuating dipoles in the cortex are the responsibility we are seeing or we are having. Are you clear? Now comes the question, what is the basis of the EEG activity? So remember, very simple rule, brain activity is proportional to frequency of the waves. So in simple language, more is the brain activity, more would be the frequency of the wave. Like example, a person who is in sleep will record a low frequency and a awake person or doing some activity will record a high frequency. Are you clear? In fact, if there are abnormal activity you can detect in like epilepsy and in seizure disorder, it is the IOC. Which is IOC? Yes, our EEG is the IOC for the seizure disorder. Okay, let me give you some patterns to remember. Okay, like example, they might ask you 3 hertz wave and spike pattern. So if they ask 3 hertz wave and spike, it is seen in absence seizure. If they give you 4 to 6 hertz poly wave and spike, then it is what thing? It is your myoclonic. So it is called as myoclonic seizures. Example is Zayn syndrome. Then you can also see a very special pattern called as hypersrhythmia. That is an infantile spasm. There is a high activity without any pattern, that is called as hypersrhythmia. High voltage, high frequency, irregular activity is infantile spasms. So these are some of the abnormal patterns of EEG that you can see clinically. Now, if brain is becoming less active, the frequency will fall. So that is why decreased brain activity cause decreased frequency of EEG waves. Example, hypoxia. The brain is not getting the oxygen, so obviously neural firing will decrease. Hypothermia. Then there is also what? So hypoxia, hypothermia. Also what else we see apart from the hypothermia? Yes, there could be our hypercapnia. Now there is a mistake. People think hypoxia and hypercapnia. Remember, they suppress the brain activity, whereas hypocapnia is excitatory. If they ever give you hypocapnia, understand it is excitatory, not inhibitory. Hypercapnia is inhibitory to the brain. Okay. Then we also have what? We also have our inhibitory agents. Like example, a person is having drugs which are example benzodiazepines. They can suppress the brain and cause low frequency wave. Okay. Then any coma or even general anesthesia. So general anesthesia again causes a decrease in the frequency of our wave. So these are all condition causing low. In fact, in GA we use what? EEG as a tool to assess the depth of anesthesia. So that is why EEG used to assess depth of anesthesia. This is called as bispectral index. So they ever ask you what is bispectral index, the answer is it is a method used to know whether the brain is sufficiently in anesthesia or not. So that is why these are condition causing very, very low activity. Okay, abnormal activity disorders, we can see the conditions like which one? Like our 3 hertz, 4 to 6 hertz, or hypersrhythmia is an infantile spasm, or we can have burst suppression patterns, multiple type. Okay.